Okay. I think we're going to go ahead and get started. Thank you all for being here for the Triage 2023 Triage program, the Navigating Affordable Healthcare in North Carolina CLE. My name is Cassidy Estes Rogers. I'm the director of the Family Support and Healthcare Program, and I'm joined by my colleagues today. But I'd also like to introduce our champions for this project. Chelsea Corey from King and Spalding, Kim Cochran from Novant, and Melissa Romanzo from Bradshaw, who is hosting us today. So thank you all. Your champions are another resource for you during this process. As you volunteer, you can reach out to them for assistance and helping partner with us, and also serving the consumers that you will meet along the way. So with that in mind, I'd like to invite Chelsea to come up here and tell us a little bit about her experience and her role as a champion.
Hi, everyone. I have been a healthcare champion since the Triage project started. I think it is an absolutely fantastic way to kind of give back to the community in a real tangible way. You will see that enrolling in healthcare can be, in my opinion, needlessly complex, but we can bring our resources to make that simpler for folks that need healthcare. I think, you know, it's just one of the most, as a litigator who often has a very, very long time horizon on all of the things that I do, the immediacy of signing someone up for healthcare is rewarding for them and rewarding for me. So I think everybody is served by doing this work. I also think that the beauty of this is there's a real need. I think we'll speak today about kind of the numbers of people that need to be enrolled, but there's just thousands and thousands of people that need healthcare. And I think we all can appreciate the way that it changes people's lives. So as you guys hear more today, I think my first impression when I was doing this is like, this is too much information. And I promise you it will get easier. You will learn the rhythms, and your champions are always here to help you. And I think that we've decided this year, also a lot of you who are starting out fresh are going to, have sort of like ghost shadow sessions where you get to see how people do it. And I think you'll see when you see it in real time that it's really just, walking through forms with people and going through it in a, compassionate and logical way and helping them get to the healthcare that they need. So thanks so much.
So hi, everyone. Thank you for participating in this year's CLE about navigating the access to healthcare in North Carolina. I know, as Chelsea mentioned, it's a little bit broad topic, and sometimes it looks like complicated, but believe me, it's not. It's very straightforward. And as soon as you get the rhythm of the applications and to navigate and help our consumers, it's a satisfaction to help someone that really needs access to healthcare in our state. So my name is Natalie Morles. I'm the manager for the Navigator program at Charlotte Center for Legal Advocacy. I've been a navigator for more than 7 years now. So I hope that we get all of you interested in this project and help us out during open enrollment. So this is going to be the agenda for today. We're going to have like a North Carolina overview about healthcare access, and also the ACA overview, health insurance options, marketplace, Medicaid overview, and then Natalie will close us up with a call to action and how can you get involved in our project. So I guess for everyone that has been participating in the Triage, this is kind of like a redundant topic, how the ACA came up. But for the new people out there that wants to help, on March of 2010, President Barack Obama passed and signed the Affordable Care Act. So that law put in place a comprehensive health insurance for a lot of Americans, and that brought a larger expansion on how US manage the access to healthcare. The ACA actually came up with these two expansions. One is in assistance to get premium monthly payments for Americans that are eligible for access to healthcare through the marketplace, and also in some of the states to expand Medicaid eligibility for the adults. That is actually happening in North Carolina soon. So we are excited that finally, after more than 10 years since the law has been passed, we are finally a state that is going to expand Medicaid. So just to give you a little bit of overview about North Carolina access to healthcare. So right now, our population is more than 10 million of North Carolinians. And if you see the chart, there is still uninsured. There's almost more than 900,000 North Carolinians without insurance. And those are the ones that we need to reach out and help. For Marketplace, last year we had a lot of enrollments. We actually went over the record for the few years. And Medicaid also is with a lot of changes recently, so that also increased on the Medicaid. And the pandemic, of course, played a little bit on that increasement of Medicaid enrollments and Marketplace. So for North Carolina, the Marketplace right now, we have 850,000 North Carolinians signing up last year for open enrollment during the November 1st to the January 15th of this year. And we have almost 200,000 new enrollees, which was huge. And thank you for everyone that helped us. And I'm going to show you a little bit of the Mecklenburg numbers, so you get more excited to volunteer. Actually, Charlotte Center for Legal Advocacy Navigator Project is part of the North Carolina Navigator Consortium, but there are like 10 organizations across the state helping and doing the same job that we do. But for Mecklenburg County specifically, Charlotte Center for Legal Advocacy Navigators are the only ones that are doing this job. So these numbers actually means a lot to us because we've been like working crazy to help everyone that needs access to healthcare. So in Mecklenburg County, the average for premium with financial assistance is kind of like $75 for a family. And that means that 90% of the people that are getting into Marketplace actually qualify for financial assistance. We had 26,000 new enrollees, and we have 107,000 enrollments total in Mecklenburg County last year. So going back to the law and what the ACA, so the ACA created like some provisions for and protections for consumers to getting access to healthcare. And one of them is the ACA placed many requirements on private health insurance plans. That means that previous to the ACA, if you have a pre-existing condition, it was almost impossible to get a health insurance. Those kind of like requirements went away when the ACA started. Also, the end of annual and lifetime limits. And now is by law that they need to provide preventive care for everyone that is on a Marketplace plan, regardless of their situation or pre-existing conditions. Also, the ACA placed many new requirements on private health insurance plans, like through an individual insurance company or through the Marketplace. So they have access now either through health insurance company or through the Navigator and the access to healthcare and the healthcare.gov website. There are 10 essentials health benefits that the ACA also is providing, and those are like big visits for doctor's appointments as an outpatient services. Those are included in every single, so all these 10 benefits are for any plan, depending, regardless of their level. And we're gonna talk about a little bit more about the levels on Marketplace, but every single plan on Marketplace have those benefits included. They have emergency services as hospitalization, maternity and newborn care, mental health and substance use disorder services, prescription drugs, rehabilitation and habilitation services, laboratory preventive service and chronic disease management, and also oral and vision care are included for all children. So the free assistance is that as part of the ACA law, they assure that they're like navigators like us, helping the community understand all this and how to navigate and which plans is more beneficial for them and their families. So the ACA provides an assistance through a grant that we are federally granted through the ACA to provide free assistance to any consumers that needs understanding their healthcare options. So those federally funded staff are referred as navigators or as a certified application counselors. We are the navigators part. And they provide objective, non-biased information. We cannot tell anyone which plan they need to use or they need to enroll. However, we are trying to educate them in the best way that we can with all the information that they provide in which plans are more beneficial for them depending on providers or any medication. And now Natalie is gonna give you a little bit more of the overview about healthcare marketplace.
Before I start talking about the healthcare marketplace, Natalie and Kelsey mentioned there's a lot of information that goes into it. But our clients really don't need us to know the ins and outs of every single piece of information. They really just want us there to provide comfort for them, to walk them through the steps and make them feel like they have support. It's a really big decision that they're making, their health insurance for the year. So don't be intimidated by all the information we're throwing at you. Ultimately, people are just looking for support. And that would first and foremost be the most important thing, volunteering with us. So the health insurance marketplace is where we go to help our clients see what options are available to them. Marketplace is a new way to find and purchase quality health insurance. Each plan must meet those basic minimums that Natalie just mentioned. A lot of our clients tend to not know that, so it is something we like to go over with them, just because when people hear that a plan is low cost and affordable, they may think that they're not getting the same quality of care. But our job is to really make sure they know that just because they can afford it, that means they will be able to use it and it will be a good plan for them. And then the financial assistance that is available for them is based on age, geography, and tobacco use. The financial assistance that goes towards the premium, and the premium is based on age, geography, and tobacco use. The lower cost in the marketplace, the two types of financial assistance that you will go over, or we go over with our clients, are the premium tax credits, which can be paid in advance directly to the insurance company. And the amount will vary depending on income and family size. They have the option to use those all at once or not at all, their choice. And then we have the cost sharing reductions. This reduces the out-of-pocket costs for our clients. It lowers their co-pays, deductibles, and health insurance. And then it is available to families with incomes below 250% level. And we'll discuss that. Marketplace plans have the options for bronze, silver, and gold. As navigators, we kind of talk folks through. The gold plans are for families and individuals that have extensive health needs. It's not always the most practical for a family who just goes to the doctor a few times a year. And then you have the bronze. The bronze is probably the most affordable, but not the most inclusive. So we typically will suggest that for someone who's not going to the doctor a lot that year. And then the silver plans is usually where we start. They are the most cost efficient for families that we see. And the marketplace offers more incentive for them to select those through extra. So as of right now, we think that the insurance companies available in North Carolina will be those on the screen. Big names like you'll recognize: Blue Cross Blue Shield, United, Cigna. This is for Mecklenburg, Barris, and Union. It'll be shortly before we know about the entire state. But for now, we're hopeful and optimistic that they will be in the entire state. Catastrophic plans. I don't see a lot of people take on the catastrophic plans, but they are plans with very high deductibles and lower premiums. That includes those preventative services that also must meet those 10 healthcare requirements that Natalie mentioned. And this protects consumers from high out-of-pocket costs. Who's eligible? Young adults under 30 of age, or those who cannot afford coverage or obtain a hardship waiver. So if someone has had some sort of tragic event and it's going to put an undue burden on them financially, we can assist folks apply for that waiver.
I was just gonna ask, there's no financial assistance for catastrophic plans, are there? Is there?
Great question, Tim. So who is eligible for financial assistance? Income between 100 and 100% of the poverty level. Though as navigators, we are able to help folks who are above and below that line. U.S. citizens or legally present immigrants. Immigration is very challenging. It's a lot to take in, but we provide a lot of resources about immigration eligibility, so it does not have to be intimidating when you're in those conversations with families. And then they have no offer of affordable coverage. We see a lot of part-time workers who are right at the max for their jobs and have to offer them insurance. We're able to walk them and their families through what is available. Or if someone has employee-sponsored coverage, but it is right now more than 9.12% of their income, next year it'll be lowering next year, which is good for our clients. And then they're not eligible for public coverage like Medicare and Medicaid. A lot of people will come to us thinking that they are eligible for one, and then we end up doing a completely different plan, just about getting to know them and their question, or answering questions about who they are and what makes up their household. Marketplace income eligibility. We will look at this to just gauge how much income do you have in the year. For an individual like myself, and it was just me, it would be that $14,580. That's the minimum that I would have to make in that year to qualify for a marketplace plan. If you have someone who is a single person and they make less, they may not qualify for those tax credits. So we always start with that income question because it makes a big difference. And then employee-sponsored coverage. That is an individual with the offer of affordable employee-sponsored coverage, but they may be ineligible for marketplace. An offer for employee-sponsored coverage or an eligibility for subsidies. Those mean affordable, being less than 9.61% of the annual income and meet the minimum value standard. So if their plan does not meet those 10 values that Natalie mentioned earlier, they were then maybe eligible for marketplace. Most employer benefits do cover those essentials. However, it can get very costly for a family of 4 or 5 in those plans. So now I'm going to give it back to Natalie to discuss.
So Medicaid in North Carolina, Medicaid is a state program for access to healthcare. The ACA is the federal program. So for Medicaid, there's a lot of changes going on right now. So as today, September 20, this is kind of like what is required and what is in the law. So Medicaid in North Carolina, we had an increase due to the pandemic on Medicaid applications and Medicaid eligibility. But 1 out of 10 adults ages from 19 to 64 are on Medicaid right now. 2 in 5 children, 5 in 8 nursing homes residents, 1 in 6 Medicare beneficiaries, and 1 in 3 people with disabilities. 60% of the non-elderly Medicaid enrollees are people of color, and 58% of adults on Medicaid are working right now. So as June of this year, the North Carolinians that are on Medicaid is 2,931,557. So Medicaid, again, is a state program that actually offers and improve access to healthcare and improve health outcomes to North Carolinians, and also increases the access to primary care providers like regular checkups, preventive care, and other services, and services for chronic disease, and for low-income families. Medicaid covers and reduce medical debt for low-income households, and there are currently 2.9 million of North Carolina receiving Medicaid, in some full Medicaid, in some form. So basically, the Medicaid is not one program only. There are like a few programs on Medicaid. So there are like Medicaid for pregnant women, Medicaid for children, Medicaid for disabled working, Medicaid for disability. So there's like a lot of programs on Medicaid. And every single program has their own rules and eligibility. So people can qualify for one of them. Also, there are over 20 pathways to Medicaid eligibility, and we will be discussing those more categories later on. So there are basically 4 requirements to be eligible for Medicaid, that they need to live in the state where Medicaid is being provided. So they need to be in North Carolina or have the intention. So if we have a lot of consumers that just moved to North Carolina, they have to have the intention to move to live in North Carolina permanently to get access to Medicaid. DSS will require proof of residency for that. Also, as Natalie mentioned it, there are a lot of immigration eligibility rules, and we have what is legally present versus qualifying immigrants. So for Medicaid, they have to be in one category to be eligible for Medicaid, and also must be a certain group of categories of people. Like I mentioned, there's a lot of programs within Medicaid, so they must meet the requirements for that specific program that we are applying. And income is another factor that will be as a requirement for enroll in Medicaid. So there are different categories, there are different incomes, and we are going to see that later on in the presentation. So what is the automatic Medicaid coverage? So certain individuals are automatically eligible for full Medicaid because of other benefits that they are receiving. For example, if they are receiving SSI, which is the Social Security Supplemental Income, they will automatically be eligible for Medicaid. If they are receiving a state or county special assistance, like program for age or disabled individuals who are primary in adult care facilities, they will be eligible for Medicaid automatically. And the last one is beneficiaries receiving a special assistance in home. So those are kind of like that you don't have to do any process for applications. They will be automatically be eligible for Medicaid when they are receiving any of those programs. Medicaid categorical eligibility in North Carolina. So these are kind of like, these are not the whole list, but they are like the most common for who's eligible to get Medicaid in North Carolina. So right now is infants and children under 21, pregnant and postpartum women, parents or caretakers, relatives of any of children under 18, people who are blind or disabled, people who are 65 and older, plus many more like foster children up to the age of 26, adoption subsidy children, women with breast or cervical cancer, and as I mentioned it on my introductions, we are now a state with Medicaid expansion. We just haven't implemented yet, but when the implementation starts, there will be a category for anyone that is between the age of 19 and 64 that will be eligible if their income is make them eligible for Medicaid. There are also limited Medicaid programs for specific populations like family planning, Medicare savings, and emergency Medicaid. So for the income eligibility requirements, unlike the marketplace where we kind of like project the income for a household for the following year, Medicaid actually works different. Medicaid will count your income for the 30 to 60 days prior to the application. And that is in a monthly earning income, not an annual income, because people incomes may change, and Medicaid rule is to get the monthly income, and that's why they take the 30 or the 60 days prior to the application. So there are some exemptions, income changes prior to the date of applications, and we also can apply for retroactive services. So that means that we can go up to 3 months before the application to get Medicaid coverage for that household. These are kind of like the percentage of the federal poverty line that we follow depending on the program. So for example, for pregnant women, which is MPW, is 196% of the poverty line. And for children under 18 is 210? 219? 19, yeah. And parents and children are 46%, unfortunately, and disabled and elderly are 100% of the FPL.
Not for long.
I mentioned it that as today, September 20th, these are the
One like just practical note, this was one of the most frustrating pieces of doing healthcare navigator appointments before with having the Medicaid gap. Because for me personally, I would say a solid 25% of appointments would be with somebody who didn't make enough to qualify for marketplace healthcare, but didn't fit into one of the like distinct categories, because the distinct categories are narrow, right? Like you have to be pregnant and there's very like just specific things. And so when they say like the income is one of the first questions, I cannot stress that enough, going through the income first, because there's nothing more heartbreaking than spending an hour with somebody and then figuring it out on the back end that they didn't qualify.
What's so exciting
It's
is
so
that-
exciting.
is that you're enrolling people for coverage effective January 1. Medicaid expansion will be implemented no later than January 1, either December 1 or January
Right.
1. Therefore, you don't, there's no such thing this year as somebody in the coverage gap. That
Exactly.
is incredibly exciting and really solves that whole problem.
Exactly. So yeah, so it's something I think we still have to be aware of, but I just from past experiences, it's so exciting because telling someone they're below a level of income to qualify for a tax credit is just nonsensical. I've never been able to explain it to somebody. And so you guys don't have to have that conversation anymore. It's great. We just got to pass the budget first. So
We did, we're about to.
yeah.
Deals
Stop
done.
jumping the gun and shut your mouth.
Yeah.
Before you jinx it.
Okay, so going back to immigration eligibility. So the immigrant community is actually one of the largest group of people that we assist, because there is a lot of misinformation, and unfortunately there are a lot of frauds and scams that are happening, especially after the pandemic, through the marketplace, because not every immigrant will qualify for either marketplace or Medicaid. And unfortunately, that's kind of like our main topic of education right now, to make sure that those vulnerable populations will not get a scam or fraud because of health insurance. So there are like two difference between qualified immigrants and versus lawfully present immigrant. So for qualified immigrants, they actually will have an status that will become eligible for Medicaid or for Marketplace. Those status are that they are legal permanent residents, refugees, asylees, or person granted withhold of deportation removals, Cuban and Haitian entrants, victim of traffic, battered spouse and children under the VAWA visa, and there are others. For the qualified immigrants, however, there is a rule on Medicaid that they need to have at least 5 years with that status. There are like only 2 exemptions, which is pregnant women and children that are not that are exempt for the 5-year bar rule. But however, if someone with permanent status that maybe they are 66 and they've been an LPR for 4 years, unfortunately, even the age and the income will make them eligible. Unfortunately, their immigration status will not. So that's some of the rules that we have to make sure that we understand that, so we don't give false information or hopes to a household that will not become eligible for Medicaid. And then lawful present immigrants, this is a very broad, every day there's a new visa coming up, there's a new status, so we try to keep up with all those changes. But basically for the legal lawful present immigrants is anyone that has any type of visa or status in the United States. That includes U visa, TPS, which is a temporary protection status, non-immigrant status like a student visa, or there's like a new work visa for different countries that now has less requirements, the special immigrant juvenile status, and also, so on that specific DACA, even though it's a law and they are legally present in the United States, they have a work permit. However, for access to healthcare, DACA recipients are not eligible to receive any services, which is sad. But this year, actually early this year, the president has a new proposal for getting DACA recipients into Marketplace, so they will become eligible for getting APTCs. However, as many of the topics that we care about is on hold, and they haven't made a decision for that rule. So we are hoping and waiting that if it's not this year, next year, the DACA proposal for getting DACA recipients on Marketplace will pass.
If DACA survives at all.
And these charts will help you and will be your best friend, because actually it kind of like guides you like who's qualified immigrant, who's legally present, and what programs are they qualify for. And they're like, again, the 5-year bar rule that we're gonna talk about it now. So the 5-year bar rule basically is that anyone with those status will need to be living in the US with that status for at least 5 years. So we have a lot of clients that they don't understand like the 5-year bar rule because they've been living in the States for 10, 20 years. But unfortunately, if they are recently getting a green card or a change of status, those are gonna prevent them to get Medicaid. This is only apply for Medicaid. This will not apply for Marketplace. So for that, we will have Marketplace if they, and the good part is that, remember that Natalie mentioned that for Marketplace, you have to be at least 400% of the FPL to qualify for financial assistance. For this specific category, for the ones that are less than 5 years, with a status, they actually can have 0 income and will still eligible for financial assistance. That's one of the exemptions for the 100 and 400% of the FPL. This is also another resource that we will provide, and it's kind of like explaining a little bit what family status will qualify them for Marketplace Medicaid, and the difference between, again, the qualified immigrants versus the lawfully present. So undocumented immigrants, unfortunately, are not eligible for any access to healthcare programs. And DACA recipients, as I mentioned, it is as today is also one of the programs that will not be eligible for Medicaid or Marketplace. These are the categories and the monthly incomes for the most common programs for Medicaid. If you see that range, and actually kind of like change a little bit of depending of the program. For children and pregnant women, those are the ones that have the majority of eligibility due to the income. And now Cassidy will talk about the Medicaid extraction.
Hottest topic in the room. All right, so
We're going to talk a little bit about Medicaid expansion, but also just the current landscape of Medicaid right now, because it will affect some of the conversations that you have as you work with consumers, whether it be in the marketplace or with their Medicaid eligibility. Before we jump into this, we may have jinxed Medicaid expansion. We were very excited to add Medicaid application assistance as an option for this triage program, as it was intended to start on October 1st. Would have been great timing. I would have been celebrating, and we would have started, we would have had another training next week to teach you how to do a Medicaid application. And then the legislature, Raleigh did what Raleigh does. So where we are now is the law, it is law. Medicaid expansion is law in North Carolina. It was signed on March 27th. We're the 40th state to expand Medicaid. So there's still 10 stragglers out there. And the exact date for implementation, Doug is being very optimistic. I don't like to throw out any numbers or dates right now because I feel like it's a risk. But yes, we do hope to have Medicaid expansion as soon as possible. And the budget vote is supposed to be tomorrow. There was lots of news coverage on the budget and how they have treated Medicaid expansion and its ties to that. So what will it mean for people? What was the Medicaid gap? What gap are we filling? The gap that we are filling are North Carolina residents ages 19 to 64 with countable household income that is under 138% of the federal poverty line. So this not only fills a gap, but makes a sort of new rule for some of North Carolinians that you might be serving. Previously, if someone had 100% to 138% of the federal poverty line in income, household income, they could go on the marketplace. They just didn't qualify for Medicaid at that time. Now, once Medicaid expansion is implemented, they won't be able to go to the marketplace anymore. So effectively, our marketplace income limits will start at 139% because anyone who is under 138% will be able to receive Medicaid once it is implemented. So that may be sort of an unintended difficult conversation. Why can't I keep my old plan and why do I have to move to Medicaid? But there are lots of benefits to that. And generally Medicaid is premium free. There may be some limited copays, but they don't preclude you from getting services. These persons will no longer need to fit in one of those narrow categories that Chelsea mentioned and that Natalie kind of outlined for you. They don't have to be disabled. They don't have to be a caretaker. They don't have to be a child. They don't have to be pregnant. They just have to be a North Carolinian and they have to have the income that's under the limit. This is also the income eligibility rules that we use for this population are just like the income eligibility rules we use for the marketplace. So that means that there are no asset tests for this Medicaid population. So we also don't have to go into all those questions about, do you have a car? Do you have two cars? That we would for some of the more traditional Medicaid programs like those for the disabled or blind. And the applicant, it does not change any of the immigration rules. So what Natalie said about immigration eligibility, lawfully present that still stands. That only applies to children and pregnant women. So we still are subject to all the regular immigration rules for this population. And what another population that you may encounter is that won't be eligible for expansion are those who are 65 and older. And you say, why would they need that? There are a lot of people who would really love to get Medicaid in addition to the Medicare that they're receiving. We do have a lot of people who are what we call dual eligible, but to become a dual eligible, you still have to be 100% or below the federal poverty line. You also can't be a Medicare recipient. So some people who aren't 65 are receiving Medicare due to their disability. So if you are receiving Medicare, you will not fall into the expansion category. That is one of the carve outs that was in the original statute. So one thing that we are doing as we're going through this, one of the things, and I'm going to give a little more context than this. What does this mean? Right now, North Carolina's Medicaid is going through a huge transformation, and it's what we are calling the unwinding. And what that means is during the public health emergency, there were some provisions put in place to help people continue to receive Medicaid. So there was no interruption in their care. Unfortunately, that was decoupled from the public health emergency, and they started a process for states to get back to sort of regular business, reviewing Medicaid cases every year. At least every year. And so that started back in April of this year. And there are people who are on Medicaid now that maybe shouldn't be on Medicaid. Maybe their income was lower during the pandemic. They got laid off and now they have a new job. And so they're no longer eligible for that very limited category of caretaker, maybe. But they remain eligible for a lesser category of Medicaid, which doesn't cover very much, by the way, is family planning. And so all these things are going on in the background, and we'll talk a little bit more about those. But one of the tips that we want volunteers to remember is that if someone gets on family planning Medicaid, and in the past year, they've been either reviewed or have completed an eligibility determination in the last 12 months, the state plans to capture those individuals who have that type of Medicaid, whose income was certified at under 138% of the federal poverty line, and do a streamlined application into expansion. So one of the things you may encounter here is someone who recently lost their Medicaid and is like, well, I got this family planning Medicaid. I can't, I'm a man, I don't need a pap smear. And that's what it covers. And so we don't want them to terminate it, right? We don't want them to terminate it, or maybe we want to help them apply for it now because we know that this could help them in the future. But during this process, we want to make sure that people aren't losing this type of Medicaid, even though it's very limited, and that they're keeping it so that they can be captured by the state. Now, one person who comes to you who maybe let's say they lost their full Medicaid in June and they're reduced to family planning, expansion isn't implemented right now, so they can go into the marketplace because this is not minimum essential coverage. So they could go ahead and sign up for a marketplace plan because they meet the income eligibility if they're over 100%. And they could have the family planning coverage and the marketplace coverage. And then when expansion rolls in, they'll need to drop the marketplace coverage. But it does not mean that someone has to sit there and wait for Medicaid expansion to be implemented. If someone comes to us right now, which I'm sure many of you won't necessarily be handling cases right this moment, but there are just a lot of how this all works together is really important to just try to keep in your mind's eye.
What is family planning Medicaid?
Family planning Medicaid, or also known, North Carolina also likes to give fun names to some of the categories. It's called Be Smart. So it is, does that give you a hint as to what it covers? It covers contraceptives, it covers pap smear, annual visits. It does do cancer screening as well. So it is not considered minimum essential coverage. It covers some very basic types of services that, that relate to family planning, and pregnancy. So, but there are no age limits or gender limits. There is an income limit. It's a 195%. So there are plenty of people who are like, oh gosh, I don't need this, right? But right now it really has a value outside of the services that it covers. So we want to make sure we're communicating that to people and people aren't just willfully with, terminating in that program or not returning information because they don't care about that coverage. There are real good reasons to educate people about it. But while we wait for Medicaid expansion, which the date will not be said, 640,000 people are waiting in the coverage gap in North Carolina. It's the latest estimate that we have. During Medicaid unwinding, which is going on right now, roughly 9,000 people per month are losing Medicaid that are going to be eligible when expansion is implemented. So we know at least 9,000 per, at least, and I think that's a low estimate. At least 9,000 people per month are kind of churning through the system, right? They're going to lose the Medicaid they have. They may, if they return all the documents, get reduced to family planning and get captured back in. But what we know from data is that many people are not providing the information. They're not getting processed correctly during the unwinding period. And so many of these people, while it's nice that the state is capturing those who do complete the process, many of those people we're going to have to, pound pavement and find them because they've now gone off the program and they may or may not learn that they are going to become eligible again. So we are expecting to see an increase in individuals and families seeking marketplace for their health insurance, but we need to keep this new category in mind and keep abreast of all the changes because there are people going through multiple processes at this time. Maybe they just lost their Medicaid or maybe, and they think they're going on the marketplace, but really they're going to be expansion eligible. So it all kind of works together. And just a little plug about that. Before unwinding or the pandemic was a twinkle in our eye, North Carolina didn't do this process very well, surprisingly, or not so surprisingly. And National Health Law Program and Charlotte Center for Legal Advocacy filed a federal class action to help to challenge these improper Medicaid terminations. Lead counsel is in the back row. I'll ask him to hold his comments till the end because I'm sure he'll have some. But we did reach a settlement agreement on this class action in 2022. Just in time, and we worked very hard to do that because we knew that unwinding was coming. And so this particular class action goes directly to Medicaid redeterminations and helping people in that process. The class action basically came up with some processes to protect people during that process to make sure that the state was complying with federal law to consider people under every category. Wouldn't it have been nice if we had Medicaid expansion before unwinding so they'd have to have followed that and consider everyone under those categories, but unfortunately that didn't happen in time. And there were several, and also we corrected and worked with the state to come up with clear manuals, clear notices that tell people what their rights are. And this goes even after the unwinding, which lasts until May of next year, these provisions will still be in place. So just a few things that you're going to need to listen for if someone comes to you and says, okay, I lost my Medicaid, I want to go into the marketplace. We still need you to be thinking about, well, did they lose their Medicaid legally? Were all their rights protected? Were they able to complete their redetermination? Could they even reach DSS to do so? Phone access is a huge issue with our local DSSs. Medicaid also, as Natalie mentioned, is a state-run program, but it's county administered in North Carolina. And what that means is we have 100 different counties trying to implement these very complex rules and regulations, and the results vary. That's what I'll say. And if you can't even reach them by phone, it really can affect them. So eligibility, it has to be considered under all categories, as I said before. all Medicaid beneficiaries, so someone already receiving Medicaid or who was recently terminated, have the right to receive assistance from DSS during this process. That sounds like a lofty goal, but there are real reasons why someone might need to get actual sort of hands-on assistance from a DSS worker. Maybe they have issues accessing their bank accounts to provide financial information. Maybe their employer isn't wanting to verify their employment, things like that. And there are certain things during the unwinding, I'm not gonna get too deep into because it'll take us on a whole nother training, that are protected during the process as well by the federal government and the rules they have in place. They have the right to have any reported change within 7 days. And this matters because if you can't get through or you report a change and they don't act on it, you may lose Medicaid and not and still be eligible. You have your right to have your rights and responsibilities explained by people who, whether it's the state contact center or your local DSS, and you have the right to receive written notice. So I'm sure we're going to see as you come into this process and meet with consumers, a lot of people who were former or think they're former Medicaid recipients and that were terminated, that these parts of the process were not completed. And they also don't have to be asked about information regarding people in the household who are not applying for. And that's important for our immigrant families in particular, because there's a lot of fear around Medicaid and even Marketplace that, that there will be some immigration consequence. And also a training for another day, but that is just simply not true for almost all programs, with the exception of a few extensive programs of Medicaid, like long-term care, when you're in nursing home level of care, or certain services that are similar. But generally, just receiving Medicaid, and especially when it's your United States citizen child receiving, have absolutely no effect. And that's why it's important that people not be asked for information that may go beyond. So next, I'm going to pass it to.
And also to keep in mind that Medicaid is required to send notice in 15 different languages. And what we've been seeing in our immigrant community clients is that they are getting notice in English, or because there's only like 2 options on the ePass application, just for English and Spanish, but they are required to send it in 15 different languages.
Yeah, and actually, the settlement requires them to provide languages in English and Spanish. So Spanish is based on language rules. We have such a high population that they have to provide a full notice in Spanish, and it's programmed in the system. They cannot provide, so they have the templates, but oftentimes we see the Spanish template and then English written in the blanks, right? Like the things they actually need to provide might be written in English, right? They have this fancy form all translated in Spanish, and then the caseworker writes in English. But to Natalie's point, so the settlement, the language provisions, 15 language has to be translated in written translation, but any language, anyone who calls DSS, even if it's outside of those 15 preferred languages, have to be provided with an interpreter, and they have to read their notices to them in their own language that's accessible to them. So even any language, DSS has to provide interpretation services. So lots to go on there. I'm going to hand it over to Natalie to tell you how you can get involved in that exciting work.
Okay, so we have told you a lot of information, but ultimately what we want you to take away today is that you saw the numbers at the beginning of the presentation. There are thousands of people losing coverage this year, and even more expected to gain eligibility. But if they don't know how to access that healthcare, they may go without it, and that's where we come in. We are a small but mighty team, and having your assistance would help us support them in our community at a much larger number than we would be able to do so without you. So with that being said, there are a couple opportunities for you to join us. We have the outreach volunteers. The outreach volunteer is someone that it's a lower commitment. Maybe you only have a couple hours in the week. Year gets busy really quickly, right? So we're just hoping that you will help us call clients that know us, trust us, have heard of us, and just remind them of those important dates. Open enrollment starts November 1st and goes to January 15th. For our clients to have coverage starting on January 1st, they need to be enrolled by December 15th. So typically around the 15th, we see a huge increase in people trying to get those appointments. Last minute, they panicked because they thought they had more time. You know how it is to be a person. But then we also have January for the procrastinators. And we see an even larger number around January 15th. We ask that you make about 25 calls a week. It's self-paced. You can do it at home. You can do it on a lunch break. If you knock it out and you want another list, we're more than happy to send it to you. We just want to make sure that, 25 people, it's a huge deal for us. So that's 25 people we didn't have to call, and that's potentially 25 appointments that were made for us. More exciting, if you ask me, would be the enrollment volunteer. The enrollment volunteer, you have to complete a background check. But while you're doing that, you can make calls. You have the time. It's a self-guided training to become a certified navigator. It takes 10 to 15 hours. Maybe you're a very fast reader and a very fast learner, and it takes you a lot less time. But that is typically how it goes, and you can do that again on your own time. And then we'll have you shadow a navigator. So you'll actually see the appointment process before you take appointments. We'll be able to role play with you. You can ask questions. So you're not getting in that first appointment scared because you realize that you don't remember anything from your training. And then the appointments can be in person or they can be in our office. We offer telephone appointments and virtual appointments. We saw, like, with the pandemic, folks are getting more comfortable doing things virtually. You have kids, you have after school pickup, and then you have to get to the grocery store. We want to make, people feel like their lives matter as much as they do. So we're trying to meet them where they're at. We discussed a lot of Medicaid information, a lot of marketplace details, but ultimately know that we will make sure that you have all the resources that you need to have a successful appointment. And here is the duties for the outreach volunteer. As I mentioned, that 25 calls a week. It's not mandatory to continue on, but if you have time between November 1st and December 1st, we'd love to have you knock those out, because our appointments, they fill up pretty quickly, and the people that we've helped in the past, we want to make sure that they are a priority for us. And then disseminate the literature. If there are social clubs or groups that you're a part of, we'd love to send you a digital flyer or even a printed flyer, so folks in your neighborhood know that it's going on. And then scheduling appointments through OE. So folks know us, they trust us, they want to hear from us again. Our job is, one, to give them that peace of mind, as I mentioned, but it's also to empower them, just to know that we're still in their corner, even if they know how to do it. If this is their 5th open enrollment with us, we still want them to know that we're here. And then for the enrollment volunteers, our goal for our volunteer is to complete 5 to 10 appointments during OE. An appointment takes about an hour to an hour and a half. So over the course of those couple of months, we hope that you could give us 5 hours of your time. And then again, like I said, shadowing those appointments. You can shadow appointments as many as you need. That's what we're here for. As Chelsea mentioned, a lot of admin. It's not so much having to have all the information down. It's just kind of knowing the steps. And we think it's really helpful for you to see how we kind of transition through conversation. And that's something we'll be able to help you do. How to find us. So we're doing things a little differently this year for our volunteers. We are going to have the volunteer portal on our website, and that will be a reference place for you to look back at any time. It'll have all of our trainings. It'll have your volunteer list, and it'll have a reporting form. So at the end of an appointment, you'll complete that reporting form. Let us know what happened, if there are any additional questions that the client has, and we'd be able to follow up if needed. And then, so this is our timeline. Today we're at Triage. We're hoping today that you will be registered to volunteer with us. We are going to have the option for an in-person and virtual training. If you can't attend either of those, we will have them in the website portal, as I mentioned. The background check, it takes about 2 weeks. So in those 2 weeks, you can start reviewing materials. You can join the callback training option. And then once your background check has been completed, you have the CMS training. It is long and dense, but it is extremely helpful in empowering you to better assist the client. And then, yes.
Natalie, if a person agrees to be an enrollment volunteer and a question comes up during an appointment, will assistance be available immediately?
Yes. So we will
or myself.
so Natalie is typically going to be the one to be there, but if she's caught up, there will be sort of an on-call navigator that's not necessarily taking appointments that day, just so they can make sure that they're available for your questions. And then getting ready for OE. So OE obviously starts November 1st, but we would like for our callbacks to start mid-October, just so people have time to get their documents together. And our appointments fill up pretty fast. And like I said, we want to give our returning clients the opportunity to have priority for us. Open enrollment is a really exciting time for us. It's our busy season. It's the Super Bowl of being navigators. It sounds like a lot of work, and it is. We have a lot of fun. We'll be offering events in person at our office, as well as community events. It would be a great opportunity if you don't want to come to our office for whatever reason. You can join us at a location, and you'll be able to see kind of what we do. Get to meet the community kind of face to face. Just lastly, like the pandemic is still really close to people's lives, and healthcare, has not, that priority has not shifted. If anything, it's increased. So like I said, we're expecting a lot more people to turn out, and with the help we'd be able to.
So easy for you. You can scan that right on your phone. Right on your phone right now and get signed up.
Just make sure that the link is working.
I will say, when we have more details on Medicaid expansion, we couldn't, of course, introduce it as triage because of the timeline, but we will be in touch with our volunteers for other opportunities around Medicaid expansion. If you're an enrollment volunteer, you'll be already in that lane, but if you're an outreach volunteer, there might be an opportunity for you to expand some of the work you do around other than just callbacks through Medicaid work.
Any questions?
Carson, you running the, is there, online? Okay.
Yeah.
Any questions?
I think.
Comments?
I think it is a really critical time for this work. It is a critical time. 50,000 people a month are losing their Medicaid right now. And most of them just on paperwork reasons, not because they were found ineligible. And meanwhile, expansion's going to come in. Most of these people are not getting moved to family planning, so they're not going to get automatically put in. And then there's the whole complexity of, what happens to the people in the marketplace who become eligible for Medicaid. Now, that's not your problem, but it's just one example of what a critical next 6 months we have in front of us in terms of access to healthcare in North Carolina. And anything you can do to help us, believe me, it would be greatly appreciated.
If I could just say, there's really no experience like having someone who's never had health insurance or hasn't had health insurance in 20 years, not only have access to healthcare, but have it be affordable for them. Ultimately, numbers are numbers, but these are people who may not have known that they could have coverage for their families if they had not had that conversation with us. It feels really good, it does, because they may not remember us, but throughout the whole year, they know if something happens, they have that reassurance. So, yeah.
Like, if you've never done it before, oh, sorry.
No, I was gonna say, I'll just repeat, don't be scared if you haven't done it before, because the staff, really, the folks who are there on site will help you. It is a lot of information, and it can seem overwhelming, but it's something you can learn, and they're there to walk you through if you have any hiccups. So I would encourage you to do the enrollment volunteer if you can.
Yeah, I agree. The enrollment volunteer, I think, is a great experience. In terms of the affordability, just so like before so you can conceive of it, I would say most of the appointments that I have at least one option that is zero cost to them. You know, and then it goes up from there in various permutations and options, especially I think there's gonna be a lot more options now. But like, you know, offering somebody when, you know, who had never had healthcare before, have it be free or have it be like $11 a month. It's just life changing, you know?
And in regards to of not feeling like as you own or by yourself during the process, we can also, so for our team, we have our Microsoft Teams chat that we are very active all day. So we can create something like that for volunteers. So you will be connected with any of us who's paid right now. I'm paid, by the way. So
We're the volunteer.
but if you know someone that is in the community looking for a job, we are hiring. And yes, so they don't feel by themselves. We will be chatting and asking questions or answering questions.
And we have so many resources, and that will be in the volunteer portal. Things that make that really dense information look really understandable, because it is, when you get it, you get it. So don't be intimidated, ask us questions. You know, if you are curious, you should go for it.
Feel good online? All right, thank you guys so much.
Thank you.
And if you want CLE credit, please don't forget to sign the sheets out front at the table.
If you need your cards validated, our receptionist can do that for you.
So you don't have to.
Did you validate?